Hello and welcome. Today we're diving deep into a serious condition affecting the urinary system, bladder perforation. This is a condition where the bladder wall ruptures, leading to leakage of urine into the surrounding abdominal cavity or pelvic area. It's a critical situation requiring prompt diagnosis and treatment. Let's explore the intricacies of this condition. So, what causes a bladder perforation? The etiology is diverse. Trauma, especially blunt abdominal trauma from car accidents or falls, is a significant cause. Iatrogenic injuries, meaning those resulting from medical procedures like cystoscopy, bladder catheterization, or pelvic surgeries, are another important factor. Less common causes include bladder cancer eroding through the wall, bladder diverticular rupture, severe urinary retention leading to overdistension and rupture, radiation therapy complications, and even, rarely, spontaneous rupture in individuals with pre-existing bladder wall weakness. Let's understand the pathophysiology. When the bladder wall perforates, urine leaks out into the peritoneal cavity or extraperitoneal space, depending on the location of the tear. This leakage causes inflammation and irritation. The spilled urine contains waste products and electrolytes that can disrupt the normal chemical balance in the body. In the peritoneal cavity, urine causes a chemical peritonitis, a severe inflammation of the abdominal lining. This inflammation can lead to sepsis, a life-threatening systemic infection. If the perforation occurs extraperitoneally, the leaked urine can cause localized inflammation and abscess formation. Regarding epidemiology, bladder perforations are relatively rare, but their incidence varies depending on the population studied. Traumatic bladder ruptures are more common in younger individuals, particularly those involved in motor vehicle accidents. Iatrogenic injuries, on the other hand, are more frequently seen in older adults undergoing urological procedures. The overall prevalence of bladder perforation is difficult to determine due to underreporting and variations in diagnostic practices, but we know it represents a potentially life-threatening condition with the need for prompt diagnosis and treatment. The signs and symptoms of bladder perforation depend on the cause, location, and extent of the rupture. Common symptoms include abdominal pain, often severe and diffuse. Patients may experience difficulty or inability to urinate. Blood in the urine, known as hematuria, is frequently present. Other signs include abdominal distension, tenderness to palpation, and signs of peritonitis such as rigidity and rebound tenderness. In cases of extraperitoneal rupture, patients may present with pelvic pain or pain radiating to the thigh. Fever, nausea, and vomiting can also occur as the body responds to the inflammation and infection. Diagnosing bladder perforation requires a high index of suspicion, especially in patients with a history of trauma or recent urological procedures. The gold standard diagnostic test is a cystogram. This involves filling the bladder with contrast dye and taking X-rays or CT scans to visualize any leakage. A CT cystogram is generally preferred as it offers better anatomical detail. Blood tests may reveal elevated white blood cell count, indicating infection, and electrolyte imbalances. Ultrasound can be helpful in initial assessment, but it is less sensitive than cystography. Clinical examination, including palpation for tenderness and guarding, is also important in guiding the diagnostic process. Bladder perforations are generally classified based on their location and cause. Location-wise, they are classified as intraperitoneal, meaning the rupture occurs into the peritoneal cavity, or extraperitoneal, meaning the rupture occurs outside the peritoneal cavity. Etiologically, we categorize them based on their underlying cause, like traumatic rupture, iatrogenic rupture, or spontaneous rupture. This classification helps guide the management strategy and predict the potential complications. Treatment and management depend on the size, location, and cause of the perforation, as well as the patient's overall condition. Small extraperitoneal ruptures caused by catheterization or minor procedures may be managed conservatively with bladder catheterization for drainage, antibiotics to prevent infection, and close monitoring. Larger intraperitoneal ruptures, traumatic ruptures, or those associated with significant symptoms typically require surgical intervention. Surgical repair involves suturing the bladder wall to close the perforation. In some cases, a temporary urinary diversion, such as a suprapubic catheter, may be necessary. Broad-spectrum antibiotics are administered to treat or prevent infection. Pain management is also a critical aspect of care. Preventing bladder perforation involves several strategies. In the context of trauma, preventative measures include safe driving practices, wearing seat belts, and preventing falls. For iatrogenic injuries, careful technique during urological procedures is paramount. Ensuring proper training and supervision for healthcare professionals performing these procedures is crucial. Avoiding excessive force during bladder catheterization and being mindful of anatomical variations can reduce the risk. Regular monitoring of patients undergoing radiation therapy to the pelvic region can help detect and manage potential complications early. The prognosis of bladder perforation depends on factors such as the time to diagnosis, the severity of the rupture, and the presence of associated injuries or complications. Prompt diagnosis and appropriate treatment generally lead to good outcomes. Delayed diagnosis and treatment can increase the risk of complications such as peritonitis, sepsis, and prolonged hospital stay. Recent research has focused on improving diagnostic imaging techniques to detect perforations earlier and developing minimally invasive surgical approaches for repair. Further studies are needed to optimize treatment strategies and reduce the incidence of complications. For example, techniques like robotic-assisted laparoscopic repair are showing promise. Thank you for joining us for this exploration of bladder perforation. Remember, if you experience any of the symptoms discussed, seek prompt medical attention.